Well, I have Miss Smith, and she's a 40-year-old, white female, and she's complaining of blah, 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 blah. And he goes to check her thyroid. Well, family medicine did. So I'm going through all the workups that she's had, and everything basically looked normal. She's not diabetic. She doesn't have autoimmune disease. Like, they've ruled out all the big stuff. And he goes, you got a WW. And I said, what's that? And, I don't know what this is. I'm like, I'm like thinking through the Rolodex of all the medical terms I've learned in my mind. And he said, well, don't write this in the chart, but it's a whiny woman. Wow. And he said, this is just what women go through at this age.
Thank you to our presenting sponsor, Peloton. Let yourself run, lift, flow, and go. Explore the new Peloton cross-training Tread Plus at onepeloton.com. Welcome to Reclaiming, Dr. Mary Claire Haver.
Super excited to be here.
I'm so grateful. I was thinking about, I think we met for the first time last summer at Amy Griffin's G9 Ventures Summit. And you were on a panel about menopause, and like this show was just formulating in my mind, and you totally embodied, this idea of women reclaiming their body and their health, right? Sort of later in life, in this kind of menopause phase. I mean, well, I want to get clear on all that, which we will. And I then quickly joined your kind of posse of bajillion people on Instagram.
The Menopause.
The Menopause. And I love it. And it's so interesting to me because every time, I mean, you probably know this and hear this a lot, but every time I'm talking to my friends or I meet a new woman and we're having a conversation, if we're in an age range, and we start talking about all the changes, your name comes up. Like, and everybody is just, is such a fan and so grateful. So grateful for the work you're doing and how you're helping so many people, myself included.
I wish I could tell you honestly that, I woke up one day and decided this is my passion. Yeah. And I was board certified OB-GYN, delivering babies, doing my thing. And I really thought, like, at 35, no way in hell would I have thought I would have become a menopause specialist. Like, what on earth would I do with that? And it took experience, life changes, my patients kind of going through it with me at the same time for me to realize there's a problem with the status quo.
Yeah.
There's a problem with what we're teaching. There's a problem that women are being left out of the conversation. They don't have seats at the table when it comes to how we look at our health as we age.
Yeah. Yeah. I want to get into all of that. I guess one of the things I read about you that was fascinating to me is that you have a culinary medical certificate, right? And so what's so interesting to me is my dad's a radiation oncologist. He just retired after having practiced for 50 years. He is also a gourmet chef, and he just endowed to UC Irvine Medical School a program, a culinary medicine programs, which are not normally in medical school. So he wanted to marry that. So it was just so interesting to me.
So my undergrad is in geology.
I know. We're going to have the crystal. Don't worry. We will have a crystal moment.
I'm so excited. So I, finished my undergrad and decided last minute to, I worked for a couple of years for an oil company. So here I was in my little corporate outfit. And then I figured out this wasn't my path, but what else could I do? And I looked at nursing school, I looked at medical school, and I thought, well, let me take the MCAT and see what happens. And then, 30 something years later, here we are. Yeah. But I had zero undergrad education in nutrition. And I found myself really struggling to help patients who in their mid-30s, 40s, 50s were really, really struggling with new onset weight gain.
Right.
And the only thing I'd been taught in undergrad was calories in, calories out. And I'd give them the same, tired, work out more, eat less. It has to work. There's no other way. Hormones don't have anything to do with it until, sadly, it happened to me. So when I realized there's a huge part of nutrition that is missing from my education, I was looking for ways to fill that gap in knowledge. And the man, Dr. Tim Harlan, who designed the culinary medicine program, and he was at Tulane at the time, had come as a AOA, like the Honors Society for Medical Students speaker. And I was galvanized. And so I ran up to him at the end. I was like, sign me up. How do I do this? And he was offering the online version of the course for clinicians. So physicians, practitioners, pharmacists, anyone who wanted to get a deeper knowledge of practical nutrition, not just all the background in nutrition science, but we went to test kitchens with dietitians and learned how to cook so that we can then talk to our patients about cooking techniques or substitutions. So it was probably one of the most influential things I've done in my career. And I did it, in my 40s, very late in life.
I love hearing from you just that you kind of had these life pivots in a way and that you were really open to it. I don't know what it was like on the ground in your life in the moment, but I think so often I've had to pivot many times. And I think that so often it can become really challenging to find your footing there and to not think something negative about yourself, like that there's something wrong with you. When you realize, oh, actually, I need this to change. Like I need to make a change in my life, right? Was that hard for you? Easy for you?
I just, in my 20s and 30s, yes. But once things started crystallizing around what I want and what I really want to do with my life, and not to just follow the status quo all the time, and realize I do have power. I was always a yes girl, and I got a lot of satisfaction on making the highest grades and seeing the most patients and winning all the awards. And so my internal validation was really set on checking all those boxes until they weren't. Until I realized they weren't serving me. I was working 100+ hour weeks. I was trying to raise these two kids. My husband was working overseas. I was a single mom 6 months a year by choice. With his job. And when he was home, my husband was amazing. He really took over, took the kids to the doctor, substitute taught at the school, took them to all the appointments.
Right. But there's, I think when you are the solo parent in the house, it means you're holding all the worry. You're holding all the checklist of what have to get done.
And I still managed all the traditional stuff. Like, what are they going to wear? Like, what kind of doctor are they going to see? I just kind of sent him off on the tasks. He was basically a nanny. But he, would not change that experience. But that experience of being in crisis mode 6 months a year really helped crystallize for me, like, what do you want? What's going to make you happy? Because I'm watching my husband just excel in his career, make all these, like every 2 years, he's in a new job. He's looking for the next thing. He's working, in these incredible positions. And I'm like, what does that mean?
Sorry.
So he was, his degree is in metallurgy and materials engineering. And then he got an MBA in his 40s, right around Hurricane Ike, which wiped out our island. So
oh my gosh.
A lot of things crystallized around that as well. So he's been in oil and gas, like in an executive position, kind of moving around, working in different parts of the world in whole different fields, facilities. And it was really fun for him because every 2 years he gets a new challenge. And I was doing the exact same thing.
And I interrupted you before. So you were saying that you were
I'm like, wait,
watching,
why can't I change? Like I'm watching him do it and I'm like, what's there for me?
That's really interesting. It's really, I was, before we kind of get into the conversation, I'm sure most people listening know, but I'm going to say for me, I want to make sure I totally understand, because I like when we're talking about perimenopause, menopause, and postmenopausal, because I feel like
what those definitions are. Yeah. Great question, and probably the most common question I get because no one understands it.
Right. Because I think we're similar in age, and I think for us it was, it was the only word was menopause, and it was kind of a silent sin. It was sort of this thing of, you knew your mom was going to go through it at some point. You heard about hot flashes and weight gain.
And it just had a negative connotation. When we look at, even now, if you go to AI, it's changing slowly, and you type in, show me an image of a menopausal woman. It looks like the Golden Girls, who, by the way, were our age.
Oh my God.
When they were filming it,
Thank God for Botox and filler. But, I mean, they're gorgeous.
Dye extensions. All the things. And, it just this connotation of an elderly type.
Right. I'm grandma.
Yeah, grandma.
Yeah.
And I really love being menopausal now. So but let's go back to definitions, because I think it's so important everyone's on the same page.
Yeah.
One of the problems in medicine is that menopause is medically defined as one day in your life.
Okay.
Everything before it is premenopause or perimenopause. Everything after is postmenopause. And that day is defined as 1 year after your final menstrual period.
Okay.
1 year to the day.
Okay.
So boom.
1 year
day,
anniversary.
I am menopausal. Everything after that is postmenopause. And then we have this perimenopause and before. So here we have, the average age in the U.S. of menopause, 1 year after the final menstrual period, is 51.
Okay.
Normal, under that normal curve, is about 46 to 55.
Okay.
Okay, so we have a really wide variation of when that day might come. Perimenopause, which is the transition from normal, happy, healthy menstrual cycle in a healthy woman. You're not thinking about menopause. You've got your cycles under control. You know, at this time of the month, you're going to feel like this or that, but you've got it managed.
Yeah.
You go through a zone of complete chaos. I thought, and I was kind of trained, that the minute that the ovaries just kind of quietly
sailed off into the sunset
until they laid down for their final rest and never functioned again. They go out fighting.
Yeah.
And we can get into the nitty gritty.
Yeah.
And so postmenopause, meaning your ovaries have shut down. We have gone into ovarian failure. It sounds terrible, but this is medically what's happening. And you will never have hormones again outside of a tumor situation produced from those ovaries. So what menopause actually is, what it represents, is sadly ovarian failure. Now, why does this happen? One of the big differences, at least on embryologically, between males and females, men and women, is that men have testicles, which are on the outside of their bodies, wrapped in skin. And they are able to produce sperm. And I think I heard Dr. Crawford, she's a fertility specialist, say, I think it's 15,000 sperm a minute.
Oh my gosh. Okay.
It's insane. So like, every day, the whole system is cranking. We are born with a set amount of egg supply.
Yeah.
And that supply lasts us until they run out.
Right.
Now, genetically, there's an age at which you're kind of genetically predetermined for that to run out. Average for white women in the U.S. is 51. It's younger for African American, a little bit older for Asian descent. For Southeast Asian, so people of from the Indian continent, 46. 46 is the average age of menopause. So there's a really wide genetic variation as to when this happened. Now, say you smoke. Say you live in a very high stress environment. Say you've had chemotherapy. Say you've had radiation. Say you've had a hysterectomy or any real abdominal surgery that has set up an inflammatory process in the abdomen, because the ovaries are just floating around, in the abdomen, and the bowels slide over them, and they're not just frozen in it.
Okay. Oh, that's interesting.
So they have an attachment to what we call the sidewall, an attachment to the uterus and fallopian tube, and they kind of just
like dance around
in there. And so when we run out of eggs, that's the end.
Right. It's interesting. I took a comparative psychology class in college, and I remember sort of them talking about, with evolution and everything, that it was because of the eggs, because we have so few eggs in comparison to male sperm, and because pregnancy takes so long, the 9 months, that it was that our eggs are expensive.
Yes.
And so that was sort of what always stuck with me.
So when you think about it, we only ovulate. So we're born with 1 to 2 million. And then by the time we start actually ovulating, so puberty, we're already down to about 500,000.
Okay.
So it's a little bit of survival of the fittest.
Yeah.
And so you really want the healthiest eggs to survive. We only ovulate roughly 400 times in our lifespan. Right. And that's without suppression from birth control pills and whatever. And that by the time we're 30, we're down to about 10% of the original egg supply.
Okay.
By the time we're 40, we're down to 3%.
Yeah. I froze my eggs at 37. And part of why I had even started to look at it was because I have a friend who's 10 years older who had gone into full menopause at 40. And she had not had her kids yet. And that was, and
it's devastating.
That was I didn't even know that was something that could happen. And, going to get tested, and my FSH, and I don't remember all the things, whatever they were. It just, it was really interesting to me, because you just start to wonder, why are we not more in charge of our own health? Like, why? I mean, I don't know exactly. I'm a daughter of a doctor, but I don't know all the things.
Why do we sit around and talk about fertility as luck?
Right.
Like, oh, you got pregnant at 40. How lucky for you. That is a combination of lifestyle, genetics, planning.
Interesting.
Like, you cannot take your fertility for granted.
Right.
And, and any 25-year-old listening, your period is a vital sign. So if you're not having regular, predictable monthly cycles, you need to get ahead of that and see what's going on, because it most likely is going to have some effect on your fertility.
Right. I mean, is there a way, this was not my idea, it was a friend of mine, but he's not a doctor, but is there a way, like once we start having our period, that there's, that we are given tests to sort of more regularly understand what's happening with our fertility through, so that we feel more in charge, like instead of what I was saying with my friend and what happened, where it was this big surprise.
So there are a couple of blood tests, like AMH is one of them, and you likely had that done before they offered you the freezing. And it basically looks at, and I'm not a fertility specialist, I've kind of left that part of, OB-GYN behind when I went into traditional practice and let the fertility specialist. But AMH is basically a marker of how many eggs you have left. So we can't go in and count. There's no ultrasound or MRI or anything where we can say, ooh, but this AMH marker can tell us what your reserve is, or and based on a number, they can tell you the likelihood that you will have a spontaneous pregnancy.
Okay.
So that's usually where that starts. But if your life goal is to be a mother, and, most fertility specialists will agree, and especially if there's any history of fertility issues or you don't have regular predictable cycles, somewhere in your late 20s, if you haven't started, you should consider going in for an evaluation if it would be life-changing for you if this opportunity was taken away from you.
Yeah. Yeah, no, it's so interesting.
But right now, we don't have anything standard. Yeah. It's just like, well, good luck,
Yeah, hope you're lucky, as you said. What, if you could sort of, I know this is a semi-impossible question, but if you could give us like a brief history of sort of women's health and like how
it's pretty abysmal,
right, and sort of compare to what your vision for it is, and then kind of just even juxtapose men's health and women's health and the different hormone things. I'm just so curious to understand that.
So I was brought up in a system which has so many wonderful things about it. Like, I love everything I learned. And what I think the problem is that there are gaps in our knowledge. That a lot of when we look historically, there's like a couple of great books I can recommend. Eleanor Cleghorn's book, and then Elizabeth Coleman just wrote All in Her Head.
Okay.
And they both look at this historical lens of how the medical system has dealt with females. Everything from wandering uteruses,
thank you,
hysteria,
Plato. Right.
And how until like our grandmother's time, that was standard thought process. And when you look at the hospitalization rates and the institutionalization rates, and so many of those women were just menopausal and having these mental health changes, and that no one knew how to treat or what to do with, and they were getting lobotomized, they were put on tranquilizers. My own mother, I remember. So Mama is 88 and she has Alzheimer's, and she fell and broke her hip. She is like, what is my worst case scenario? What I don't want for myself, and why I fight so hard to change this legacy for my children. And I remember Mom talking about Butasol. Okay.
I don't know what that is.
Butasol. And I just remember that name. Okay. It was Mama's little helper. She would have a stressful moment. Now, again, she had 8 kids. One had leukemia. One's coming out of the closet. It was a very active, stressful life. They were running a restaurant. So she goes to her doctor, and now I know she's in her 40s. I remember this distinctly. I remember how old I was. She's in perimenopause. I now realize this, and they give her a prescription. And it's for something called Butasol. And I just remember her throwing that word out, like, I need my Butasol. Go get the bottle.
Right.
I can't handle this. Blah, 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 blah. And when I was prepping for the new perimenopause and doing the research, that story bubbled up in my head. I was thinking about Mama's perimenopause and what that must have been like, and like, what stories do I remember from her? And I thought, Butasol, what is that? I look it up, and Monica, it's a version of phenobarbital.
Oh my gosh.
It's a sedative.
Oh, wow.
They were sedating my mother through her perimenopause.
Wow.
And
calling it Butasol,
Butisol,
but it's like the beauty in there.
Then I go and I look it up on the internet, and I find all of these ads from the 60s and 70s.
Yeah.
And it's a lady in an apron, flipping a pancake. Get your mom back. Get your wife back.
Wow.
Bad mood, poor moods. for mama, give her this medication. I mean, this was common. This is not one doctor trying to hurt my mother. This was what the medical, so I'm just telling you that story. In my own life, I've seen how that kind of just instills. She had a hysterectomy as birth control.
Wow.
Because our religion, there's been some changes in the Catholic Church, but, I grew up Catholic and birth control was kind of excommunicated for a while. And they had 8 kids.
Yeah.
And so...
8 is enough.
8 is enough. And she was 43 with her last baby. And all of a sudden they whisked her off to surgery and they took out her uterus. So, which I never saw the pathology. Maybe there was something going on there. But she just says, I couldn't have any more. They didn't want me to have more children. And so the onslaught of that post-op course, she had incontinence as long as I can remember. Mom wearing pads, mom having to wash. She wore pantyhose to make her legs look nice, and always seeing the pantyhose hanging and washing because she was struggling with her incontinence. She had urinary incontinence. And I'm like, she had 2 or 3 procedures to try to help the incontinence. It never worked. And also now in the nursing home, she's wearing a diaper 24/7 because she has no control left over her bladder. I'm like, God, we could have done so much better by her. So I think looking historically, she kind of epitomizes the worst of medicine. There's nothing wrong with her heart. Wow. Her brain is broken. Her bones are broken. And her general urinary system is broken. And I think women deserve better.
Yeah. Reclaiming is brought to you by Audible. Emmy Award winner Kerry Washington returns as Dr. Virginia Edwards in Audible's heart-pounding supernatural thriller, The Prophecy Season 2. Picture this: a mother on the run, protecting her miracle child from a sinister cult leader who'll stop at nothing to find them. But Virginia Edwards is no ordinary mom. Haunted by visions and guided by an ancient prophecy, she's about to discover her true power as both protector and chosen one. With an all-star cast, this supernatural thriller will keep you on the edge of your seat and wondering, when everything's at stake, who can you really trust? Evil is rising, time is running out. Don't miss Kerry Washington in Audible's must-listen event of the year. Some stories change you forever. This one just might save humanity. Start listening to The Prophecy Season 2 today at audible.com/theprophecy2 or wherever you get your podcasts. It's amazing. I went down this little bit of a rabbit hole in preparing for our chat and you were referencing some of this, but I was stunned that it was as far back as 1800 BC, not AD. BC, when hysteria first came around.
Right.
And institution.
Plato, I think.
Exactly. Yeah. I mean, Plato and the wandering womb.
Yeah.
I think it was. And so
anytime in medicine, women have been treated as small men. Medicine was designed by men for men. Okay? And they're like, anything different was, she's crazy or something we can't put our finger on.
Right.
And it still goes on to this day. There's a bias built into the system. So when I talk to my Menopause friends who are urologists and cardiologists or Vonda Wright, the orthopedic surgeon, and they trained on treating both males and females. I mean, I've been in a bubble just treating women,
Right.
And they talk about this huge discrepancy between when a man comes in and he's low energy. And, so Vonda was telling the story the other day. A man came in, he had low energy. He's popping his tendons left and right. He's gained some weight. He's kind of feeling run down. He's not sleeping that well. She said, knee jerk, immediately, I check his testosterone. And then if it's low, she doesn't prescribe testosterone. She sends him on to whoever can take care of that for him.
Right.
No questions asked, no shame, no guilt, no whatever. Yeah. She said, a woman comes in with the same complaint, it's an automatic psych referral.
Wow.
So when you look at urologists, same thing. They're coming in with genital urinary complaints or, males and females or low libido or dry vaginas. Men immediately, check their hormone levels, see if that has anything to do with it, and let's get this problem taken care of. Not for women. You drag your feet. You talk about coconut oil, which is a great lubricant. You talk about lubricants. You talk about anything other than her low hormones. And that has shaped how we treat women moving forward.
Right. I remember at at the conference last summer, you were talking about something that totally shocked me and changed my life because we have a history of breast cancer in my family. My grandma had had a double mastectomy at 40. She's no longer here. Otherwise, she'd kill me for saying that on my podcast. But
isn't that so common for that generation to hide those things?
Oh my gosh. I mean, I remember because she didn't have, I mean, she was 40. They were living in Japan. My grandfather had just passed away 6 months earlier. And she didn't have reconstructive surgery. She never did. And I remember as a kid, Grandma would come visit. She'd stay in my room. And it was like she hung her boobies up at night, you know, because she had these falsies.
Oh, wow.
And so but that was, you know, that was sort of the first layer of the story for me, I think, in this history of, oh, okay, hormones and cancer, and you have to be careful. And my mom, I remember my mom saying, I'm not doing HRT, which I know we're now calling MHT, right?
And there's debate about that. So,
okay.
You know, but hormone therapy.
Right, hormone therapy. And so she didn't do that because the narrative was, oh no, we have this
cancer.
risk of, right. And so you were talking about how that has, like, when that first when the study first happened, I think you were in medical school. So I want to, take me back there to what's going on, and then where we are now.
Let's walk you through. So I was a resident. So medical training is that everyone goes to a typical 4-year program and gets like a basic medical degree, either DO or MD. Okay, and then we decide what we want to specialize in that last year. And for me, it was OB-GYN, which is a 4-year residency.
Right,
meaning you live in the hospital. That's what resident means. So I was in my training program from 98 to 2002. And most of my residency, the vast majority, was hormone therapy is great. It's an option. It will decrease her risk of osteoporosis. We knew that. It will decrease her problems with genital urinary syndrome. We knew that. And it will probably decrease her risk of cardiovascular disease, which we knew from like observational studies for decades. Okay. You got to give her progesterone if she has a uterus, so we won't cause the lining of the uterus to overgrow from the estrogen alone. You know, we knew all the ins and outs, and she'll feel a lot better. She'll sleep better. Hot flashes will go away. Great. Okay. So when we had a patient coming in, it took a few visits for us to be like, oh yeah, hot flashes, you know? Yeah. So, and let's get those treated. I wasn't looking at it as whole body health or long-term health care. You know, it was like a quick fix for a set of symptoms that would be short-term. Okay. And then 2002, the Women's Health Initiative bombshell dropped. Right. So the WHI was a pretty amazing study. To this day, one of the most expensive studies
What's
ever.
the WHI?
Women's Health Initiative.
Okay.
So we knew from observational studies that women tended to have less heart attacks and less mortality, so death from any cause, and death from heart attacks if they were on HRT. Okay, so remember, back then we started HRT right when women went through menopause, right when their symptoms were the worst. We weren't starting older patients on hormone therapy. And so they devised this study. Is this true? Is it just because people who are on HRT are overall healthier, wealthier, have access to doctors who give hormone therapy? You know, is this an artifact of just patient population selection, or is this a real thing? Okay. It was a new women's head of the NIH, National Institute of Health, who's paying for this study. I mean, this was such a big deal. We were so excited. Yeah. So they have tens of thousands of women in this study enrolled. Okay. It's a humongous study. We have, I think, 17 or 18 different universities that are participating.
Oh, wow.
So they are pulling in patients from all over the U.S. This is so amazing. And the outcome measured was, is she going to have a heart attack or not? Is this hormone therapy going to be protective? Now, they're measuring other things like breast cancer, like colon cancer, like osteoporosis. I mean, they're doing blood levels for different things. It's a pretty fascinating study. And what they notice, so they divide the women into two groups. You have, like any good randomized controlled study, you have an arm that has the medicine and an arm that has a fake. Okay,
the placebo.
And everybody's
that I remember.
Placebo, right? So everybody's blinded, even the doctors. You don't know who's getting what. They're just taking these white pills that you don't know what's in them. Okay, right. And then they're measuring the outcomes. So the average age of this study was 63.
Okay.
Because the outcome's heart disease. So they want to start with an older population because it takes a long time to develop a heart attack, and that would have made the study cost prohibitive.
Okay.
What people don't realize is that There were 70% of the patients were overweight, 40% smoked, and 30% were obese. This was not a cardiovascular disease neutral population. These were older, heavier, sicker patients that are most likely going to have underlying cardiovascular disease that's already started.
Oh, interesting.
Okay.
Right.
So off we go. They give the placebo groups getting nothing. And then we have a group that's taking the estrogen and progestin because they still have their uteruses. And then the hysterectomy ladies, which there's a lot of hysterectomies in this country, they are getting estrogen alone. And it's CEE, which is actually Premarin.
Okay.
So not the modern estradiol that we give patients. Right. And the reason why they did that, like why didn't they use the body identical, you know, exactly what our ovaries would make? Because they wanted to give the patients what a prescribing doctor would actually give. And we just weren't using estradiol back then. We were using Premarin.
Okay.
So it made sense, like, if you think about it. Off they go, they start collecting data, and within a few years, they noticed that the women who were taking the combination were having an increased risk of cancer. It was never statistically significant. Wow. Let me be clear.
Okay.
So there's a lot of politics. Turns out, who's running the study? A cardiologist, Dr. Russo, I'll go ahead and say his name, who had already published that he didn't like HRT and thought it would cause heart attacks. So we have the lead investigator is already biased. When you start a study with this is what's scaring me about what's happening kind of now.
Okay.
When you start a study with the outcome in mind.
Yeah.
You know?
I remember from graduate school and that it was just, you know, how desperately I wanted with my thesis. Like I wanted my research to be significant. Right. You know, there's that whole thing of
and you're spending $1 billion.
Right.
You know,
I was not
the weight of the world. Yeah. It's like you have all of these resources for this and you have this hypothesis and what if you're wrong?
Right.
You know? So the politics and the backstory around how this was released. So when is the last time you saw a press conference around a study that has not been published yet?
Yeah.
It was over like 10 days before the study results were available for anybody to read. And then all of a sudden it's hitting. It was viral before we had the internet.
Yeah.
It was the #1 medical news story of 2002. Estrogen causes breast cancer.
Yeah.
That's all anyone saw. I remember Nancy Snyderman talking about it. So here I am. I can't read the study. And honestly, at that point, I'm like overrun, overworked, pregnant. Yeah. And like, you know, okay, it's bad. Don't give it anymore. Fine.
Yeah.
You know, that bomb that dropped and caused a ripple and a wave. And it is probably the most deleterious, you know, effect on women's health in the history of medicine. Like how that was brought to the public, how there was no nuance in the discussion. And then how over the next 20 something years, we had so many papers walking back those results, re-looking at the data, refining it, all the nuance that never got picked up by the popular press.
Okay.
So I blame the lead investigators. I blame the media, you know, and I blame the medical system for just saying, okay, fine, we're just not going to give it and then move on.
Right.
And so what we've ended up with is an epidemic 20 years later of women whose health is less than they deserve.
Yeah. Yeah. It's, you know, I think what is interesting to me and sad to me is my background's a bit in social psychology. And so I'm thinking about not just what this means for the individual woman, but what this means to her ecosystem, what this means to her children, what this means to how she might have shown up at work, if she was able to work, in all those ways that then get sort of passed on.
The ripple effect of this
you know, is just, I think that I hadn't really thought about it that way of just how big the blast radius is, how far it goes.
And I honestly didn't realize it myself until I dug into this. Like, trust me, there are incredible researchers. There's incredible people that didn't have social media platforms that were fighting so hard to like let, you know, where is the drama around walking this back and the health of women and health span and lifespan. And it is just kind of now in the last couple of years that I think the world is able to catch up.
Right. Do you think in some way, I don't know the exact timeline. So what's coming up for me is if, you know, part of this is you're Gen X, right?
Yep.
So part of this is a bit Gen X, like We're going to fix it. We're going to figure out what the fuck is wrong. And,
I think it's exactly that.
Okay.
Yeah.
Okay. Because I'm also wondering about, and that's, it could still be that, but also this sense of whatever might have been floating in the air that we were picking up on about our reproductive rights and our bodily rights about to be taken away from us, and so this whole thing of, and what I mean is, from my perspective, the popularity now of having this conversation. Like, I feel, does that make sense?
Yeah.
Okay.
It's hard to untangle the two. And, unfortunately, politics wraps itself into women's health and medical care way more than men.
Yeah.
There's no political debate over whether a man should get Viagra, and I'm like, where are those Viagra-laden penises going, people?
Yeah.
Like, come on.
Yeah.
If he's chosen not to upgrade his, wife and to a younger version. So, and I'm dealing with the onslaught of it, of these women are like, it hurts. I don't want to do it. And he's running around with an erect penis and I have no interest in this, and so that's kind of one aspect. But under the bigger umbrella, I think this, what's happening with reproductive rights, specifically around pregnancy, abortion, termination, is really like women are, whether which way they vote, it doesn't matter. Menopause does not care who you voted for,
right?
What your politics are. She is coming for you. None of us get out of this. If we're lucky to live long enough, we will become menopausal people. And I've never seen a subject unite women so fast.
Yeah.
So, leaving, and it's intertwined with reproductive rights, but like I said this at G9, if we could galvanize women around the end of their life and their life after reproduction ends, and to think about who's voting for their health long term, not just their ability to reproduce and how that's all going to go down. I think we could really unite women over this topic, because there's no debate here. No women who goes through menopause ends up healthier on the other side.
Right.
Not one.
Wow. Yet. Right?
Yet.
That's, I mean, that's really your big mission. But I want to find it, because I have just a quote that I love, that you said, menopause is inevitable. Suffering through is not. Yeah. I mean, it's that's been my mantra of when I really thought about perimenopause. So when we look at, the zone of chaos in this transition phase, the mental health and the cognitive issues tend to get better in postmenopause. Okay.
And where we see the increasing suicide rates, the divorce rates, the leaving your job rates are really in late perimenopause, like before the periods stop. And if you're even trained to treat menopause, we were not trained to do it until 1 year after the final menstrual period. So we have this 7 to 10 year period of just, I think back, Monica, to I had teenagers, how I would just fly off the handle.
Oh my God. My first perimenopausal rage of, going from 0 to 60 in 3 seconds. And I know I'm being
crazy and I still can't stop. Yeah.
Yeah.
I was like, not myself. What was happening to this woman? Why was she talking to her daughters this way?
Right.
They were doing normal teenage stuff. And
right. But the sort of
my resilience was like,
yeah. So interesting. It's so fascinating to me. I mean, I think when you look at kind of how women's health has been treated.
Yeah.
Right. And it being a microcosm for so many things that we've seen when it comes to women.
So I'll tell you my WW story.
Okay.
So when I was in training, so we go through blocks of training, right? So my very first block was labor and delivery nights, labor and delivery, delivering babies. I was like in my element catching babies, so fun, all the adrenaline running down the hall. And then I moved into gynecology, and we had gynecology clinic 2 days a week, and then 3 days a week we're in the OR, and we just flip-flop back and forth. So I'm in clinic, and I'm going to date myself. There were charts, paper charts, before the electronic medical, before computers. So we had a stack of charts. So the top level residents would run and go find the surgery cases because they want to operate and get their numbers, and that's fine. So then I'm the lowest on the totem pole, so I just get what's left on the bottom, and I pull my first chart, and it is a woman who's in her 40s, and she has multiple vague complaints. She's not sleeping. She's gained some weight. She's having trouble with her libido. she's bounced around. She's got some joint pain, some headaches, she's just kind of, She's been to family medicine. They sent her to, neurology for the headaches. They sent her here and there. And then finally she gets dumped into OB-GYN clinic and she's still not better.
Wow.
Okay. So I'm presenting this to my chief resident, who just happened to be male. Literally, the gender didn't matter, but I'll never forget. His long white coat, his scrubs, and his cowboy boots. And it's Texas, and he's walking down the hall. What you got? He's in charge of me to make sure I don't kill anybody. And I said, well, I have Miss Smith, and she's a 40-year-old, white female, and she's complaining of blah, 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 blah. And he goes, to check her thyroid. Well, family medicine did. So I'm going through all the workups that she's had, and everything basically looked normal. She's not diabetic. She doesn't have autoimmune disease. Like, they've ruled out all the big stuff. And he goes, you got a WW. And I said, what's that? And, I don't know what this is. I'm like, I'm like thinking through the Rolodex of all the medical terms I've learned in my mind. And he said, well, don't write this in the chart, but it's a whiny woman.
Wow.
And he said, this is just what women go through at this age.
Wow.
We're really not going to be able to help her. Tell her to get a good night's sleep. Tell her to work out more and eat less. Tell her to do all the same things. And he wasn't a bad guy. This was taught to him. He's teaching it down to me. This is how we treat women. So I've stood on stages all over the U.S. now. I've spoken at multiple medical schools. And I always ask, if you had something similar, I'm like, was this unique to Texas? No. They call them whiny gynies on the East Coast.
Okay.
Total body dolor, total body pain, status Hispanicus, like why we're dumping on the Hispanic population. I have no idea, but you didn't have to be Hispanic to, have this. And, there were terms used all over the country for the exact same constellation of symptoms, vague complaints, workup is normal. She's just a dun-dun-dun-dun-dun. And we're going to pat her on the head and tell her it's going to be okay and let her move on. And now I know.
Yeah.
She was in perimenopause.
Yeah. Reclaiming is brought to you by Peloton. My friends were talking to me about that feeling when everything just clicks during a workout. That perfect moment when they're totally in the zone. I've had it before, but only on occasion. Well, the new Peloton cross-training Tread Plus was designed to help anyone reach that sweet spot faster. What makes this different? It's called Peloton IQ. Think of it as your personal fitness companion. It tracks form, counts reps, and suggests the perfect weights with intelligent strength coaching. No more second-guessing your workout. But here's the thing. Peloton IQ learns and adapts to each person. It builds personalized workout plans and connects members with classes that help you reach your goals. Not to mention instructors for every mood, personality, and vibe. It's like having someone who just cares for you during your workout. You can also enjoy other types of workouts on the Peloton cross-training Tread Plus. If you've been wanting to get back into Pilates like I have but haven't had time, the Tread Plus screen actually swivels. So you can go from an energizing run straight into strength training or Pilates without missing a beat. Talk about endless possibilities. Let yourself run, lift, flow, and go. Explore the new Peloton cross-training Tread Plus at onepeloton.com. No, it's so terrifying because I feel like I've just started to come to understand some of this in the last few years. But I was saying when I had my makeup done today for this show.
Looks great.
Thank you. Thanks, Nia. I was talking about how I've only had a few hot flashes in the last 5 years, but one of them was right after was a Vanity Fair Oscar dinner. Like I had my makeup done, and thankfully I'd gone through the photo line, and I don't know if you know Derek Blasberg, but he's a sweetheart, and he was trying to help me, and
you're just profusely
dying, and it won't stop, and it just won't stop, and that feeling of you just feel so out of control. And so that is, I think what can be so frustrating is that we have all these tropes about women, and sort of like hysterical and calm down and emotional.
Yeah. Women are small emotional women with breasts and uteruses.
Right, exactly. And so it just feels like, I don't know. I'm so grateful that this is changing now. I think about my niece, and it's going to be different for her.
It really is. I also think social media has really helped to catapult this movement, because it wasn't until I got on social media that I realized, when I see patients, I shut the door.
Yeah.
I'm isolated in a room, maybe a nurse there, while a woman is telling her story. I don't hear the stories of everybody else. And besides my girlfriend group, who I know what they're going through, I don't know what the world is thinking. Right. And when I started talking about this on social media and getting thousands and thousands and thousands of DMs and, oh my God, yes, me, this happened to me, I realized this is bigger and we're just not talking about it. But social media really allowed us to leverage that collective. And I think that's what happened kind of in me too, of all these women who had kept these stories so secret. And so, you didn't have that opportunity. The world took it away from you. But, had these experiences, realized how common, we all had so much of this in commonality. And so, frozen shoulder and the mental health changes, the rage, and now we can make it funny and we can make it fun and we can talk about it like girlfriends. Yeah. And I just love that about the internet.
Yeah. No, I mean, the internet, it's it can be an extraordinary thing, place, whatever. It can move mountains in ways that can spread information, but unfortunately misinformation and disinformation, so I mean, it's all the things, but it is, I often think back to the ice bucket challenge and I think about what you couldn't have had that without the internet.
Right.
And how much awareness that brought. And also I think it can show you that there is this connective tissue and among people, even who have very different beliefs. And I think that's exactly what you're saying about the community that you found online. I mean, and you have millions of followers, like your social media. And now you must be, I know because we talked about this a little, that you trolls and...
Oh,
yeah. And so what's your experience like with that? And has it gotten a little better? I don't know that my advice was very helpful.
So you were actually a help. When you choose to share things on social media, you have to be prepared for backlash. And when I first got into the space, I was talking about weight gain and menopause, and with my nutrition background and things that we can do. And it was so many in that personal training world who had built empires around dieting and calorie restriction and obsessive cardio were all coming in to beat me up and say things. And, when that first happened, you're and then I think I saw Taylor Swift say something about it's part of the job. Taking this stuff as part of the job. But as we're really pushing the envelope medically, and really teaching women to stand up and demand, getting pushback from some of the academic institutions and some of the organizations is tough because I was the good girl. I pass my boards every year.
Yeah.
I do all the things. And then some people in charge are whoa, slow down. We need a consensus. We need a whatever. And I'm women are not willing to wait the 17 years it takes from new research to come out for a guideline to change and all the egos involved in that room where the guidelines are changed and all the bias. Women are ready to take their health into their own hands. And they're willing to read studies themselves, So.
Yeah, no, it's amazing. So you have created these universes in a way of, the
Posse,
right?
Menopause is a group of clinicians, and it's really cool. And some thought leaders, so Tamsin Fadal, who did the documentary on menopause. Mostly it is physicians, but we have nurse practitioners, and they're really ranging across specialties. We have medical oncologists, and it's mostly women, but a few good men. Medical oncology, social scientists, urology, cardiology, psychiatry, of course, OB-GYN, family medicine, and it's just people, and we all really bonded. So there was a medical article that came out in the Lancet, which is kind of like New England Journal, but in Europe and the UK.
Okay.
They're really, really revered. And it was a 4-part series all about menopause. And we're excited, but then we're hearing the drumbeat before it comes out, and we got an advance copy. And And so we'd all been loosely talking about this menopause movement and, trying to stick to evidence and all the latest evidence. And then we see this come out and I took to the bed for 24 hours. I thought, this is going to set women's health back another generation. Like, it was so
What
bad,
was it?
Monica.
What did it say?
So basically, like, don't over-medicalize menopause. Don't even discuss treatment unless she's having severe symptoms. Ignore everything we know about hip fracture and cardiovascular disease and anything that is, and we can treat a hot flash with cognitive behavioral therapy. I love CBT, and the studies do show that it can help your perception of a hot flash, but it doesn't stop them.
No.
It makes you not think about them as much. Hot flashes are a harbinger of increasing risk for cardiovascular disease, diabetes, stroke, visceral fat, insulin resistance, and diabetes. I'm like, the worse your hot flashes are, the worse you're going to do later in life. And accusing people of over-medicalizing menopause. I mean, these were like, if you can imagine the ivory tower with researchers who were very biased.
And men, women, what's the split?
It's a split. Men and women. Even I'll tell you what, the women who are, were on that article are the most recalcitrant to anything outside of like how they've been doing things for 20 years.
Right.
And so I was just like, I'm not going to stand for it. I'm not going to do it.
Yeah.
And I'm not big in the academic research world. Like they tend to be a very cerebral select group of individuals, and this is their life. They publish or they perish in these institutions,
and they play the publishing game,
right?
In their
they
in
know
their
how
career.
to do it, and you know this, from having tried to publish before. So I'm like, I'm not going to stand for this. So we start a coalition of clinicians who are like saying, and this is all over the world. We have Australia, we have the UK, we have all over Europe, all over the US, South America, and we're like, no, we're not going to stand for this. So we write a rebuttal to the article, and Lancet wouldn't even talk to us. Like, wouldn't even publish it. Okay, fine. We're going to take it to We're going to take it to news outlets. And it was published in Ms. magazine. So we had to make it where a normal person can read it and it's not so medical. But we had over 250 signatures on it from some of the most established and well-recognized clinicians in the world. And that's one of my proudest moments in this movement. It was kind of behind the scenes, like you wouldn't, if you know, you know.
Okay.
But it was our saying, absolutely not. We think you're wrong. We think that if you follow these principles, women are going to end up less healthy, less happy, and we can do better by women.
Yeah.
So that's how the Menopause started.
Okay.
And then we all got on a group chat. It's WhatsApp because it's all over the world. And now it is where we bounce ideas off each other. There's respectful debate. We don't all agree on everything. That's medicine. There's nuance. There's new studies. We debate studies. We talk about, how are you managing this? What would you do with that? It is really one of the coolest things I've ever done. Is be a part of that. And then I try to elevate them. Right. So I have, God has gifted me in the world with this huge platform. And so I'm constantly sharing others' stuff. I took off for vacation. I went to Norway for 2 weeks and I let all my friends do Instagram takeovers.
Oh, how great.
On my page to highlight their research and what they're doing.
Okay. Oh, so that's what was going on.
Yeah.
Okay.
I was in Norway climbing mountains.
Yeah. Oh, good for you. Good for you.
Yeah.
It's interesting because you were sort of catapulted, right, in this with the social media.
Yeah, totally.
And I think you and Brene Brown were talking about, because she had a similar experience of sort of blossoming over it, very different from my
So hers
overnight.
was a TED Talk. And it just blew her out.
Oh, no.
From not obscure, but like in her field, she's so well known. But like,
of course,
all of a sudden the world knows about her.
No, and she cracked open for the entire world conversations around shame and vulnerability. I wouldn't have been able to do my TED Talk had she not,
she
done
walked
hers
so
and
you
open.
could run.
Exactly. And so she's just an amazing woman. I don't know her very well, but I know her a little bit, and she's as special
fantastic.
as. Yeah. What was that like for you, and what's it been like for your family?
Oh, so my kids, it's interesting. Most of their lives, I was not recognized in public. I wasn't famous. I didn't have a big social. I was just mom who was also a doctor, and we lived in a very small town. Okay. Then all of a sudden, right before COVID was when things were starting to kind of bubble up, and then it exploded in COVID. So we're all home, and they taught me how to do TikTok. TikTok is where I first blew up.
Okay.
And so we're all home for 2 years, basically. So like I blow up on social media, starting the menopause conversation. It really, really ignited on TikTok. Like I would wake up and there'd be another 10,000 followers.
Oh
and
my gosh.
Of course, my dopamine's popping off. And I'm like, oh my God. Yeah. And so, and I'm starting to meet other people in the space who are doing things, but they were kind of in it with me in the beginning and coaching me and don't do this, don't do a dance, point at this thing. Because my very first TikToks were to music, because that's what people were doing.
Right.
And I'm pointing to medical effects on the screen trying to dance, you know.
Right.
And then once I started talking, I'm like, oh, I can talk on this thing? Okay. So they were kind of in it in the beginning and thinking it was all fun and cute, except I was talking about menopause. Who wants to talk about that when you're 16, you know? Right. Now, so I've got one who's in medical school and it's wonderful. It's a little bit of a, she wants to stand on her own 2 feet. You know, because bless her heart, everybody's like, are you following in your mom's footsteps? Yeah. Are you, and she's like, I mean, Catherine would have gone to medical school if I would have been a school teacher. Like she was born to do this. Yeah. And so she's kind of trying to find her own path here and not have people know who she is, or who her mom is. And then my youngest is doing PR and marketing.
Okay.
And so...
Well, that's helpful.
Yeah. So she's really into it now, trying to coach me and give me advice on, what my feed should look like and all these. I never think about those things. And so it's really kind of fun. But when years ago, my niece was turning 21, we all went to New Orleans and I was kind of, at the 2-3 million mark. And we were out and some woman walked up to us in one of the little lounges with music, and it was kind of loud. And so my daughter's there with her friends and my niece and our whole family. And this woman's like, oh my God, it's you. Yeah. And, I was like, I'm trying to be gracious and nice. And I see my younger daughter roll her eyes in the background. And I was like, please, God, don't let that woman have seen that. So I, wrap it up with the lady. We take our pictures and she leaves. And so I waited till the next morning once, we were not at the club. And I sat Maddie down at breakfast and I was like, hey, you rolled your eyes last night. You didn't seem too excited about it. She's like, Mom, we're just being family and da-da-da. And I was like, this is new for all of us. And I know you didn't ask for this, but I think this is our life right now. And in public, honey, you're going to have to be gracious, a little more gracious than that. And remember that this college education and your opportunities are partially being funded by this. This is kind of part of this, and I know you didn't ask for it, and I can't stop it at this point.
Right.
And she ended up majoring in that, so it's all going to be okay. But I remember having that conversation with her.
It's such a strange. I think anybody who's gone through puberty knows what it feels like to be awkward and self-conscious, and it is a very different experience to start to be self-conscious in public because people you don't know who you are.
And I get that now. So every airport bathroom, someone walks up to me and my husband's like, if they're brave enough to come up to you, 10 people are not. So I'm always thinking, make sure your face looks like you're happy. Like don't, because I tend to have resting bitch face. And so like skew your features into one of pleasantness as I'm walking through an airport or something. I never want people to think, or
for you to feel unapproachable to people. I'm the opposite.
Because
sometimes
I'm normal. I'm just a normal girl who, I'm like, come say hi, please. Half the time I'm alone and I'm bored. So, and I would love to hear your story and, you share with me. Just, I can't be your doctor, on a subway in New York City.
Yeah.
So, but I can be your friend.
Yeah. Oh, it's lovely. I want to talk just a little bit. I know I want you to tell me about, in a second, about your new podcast and your upcoming book. But I want to talk because anybody who's listened to the show for a while knows I am a crystal freak. And so that you were in geology. So what got you into geology? And can you say something that totally affirms why it's okay to have a crystal addiction?
So I went to college. I didn't know what I wanted to do. Like I was brought up to get married and have babies and to marry well. I mean, my dad would say so, and I love my father, and he passed away, and forgive me, Daddy, you meant so well by this, but like, she's pretty, she'll marry well. Like they weren't worried about me. Okay. Yeah. I was in the middle of my class in high school. I never studied. I never tried. My cheerleading was as important as my grades. And, I was popular and just kind of, they were like, go to college, don't go to college, it'll be okay.
Get an MRS degree.
Right. And so, and then at the same time, they went through bankruptcy. The oil bust had happened in Louisiana, like in the 80s, like oil prices tanked. And so my parents' restaurant was tied to the success of the oil business with all the, whining and dining that was going on. So like my parents had lost their home. We had to, we were living in a rental. They were working for friends. Like it was a really tough time. So that was crystallizing, and I watched my aunts go through some pretty tough divorces and like have to move into subsidized housing and stuff. And I was like, I don't want that to happen to me.
Yeah.
So I kind of knew you need to have a career. Like, not because you need to have a career, but because you need to be able to support yourself if whatever marriage doesn't work out, despite my parents like, get married, Right. And so I go to college, like, what am I going to do? I don't know. I had okay grades. All my friends went off to LSU, but I couldn't afford that. So, which is in Baton Rouge, like an hour away.
I had a handbag company that was
in Louisiana. Okay.
Yeah, in Baton Rouge. So
wow. Okay.
So I've spent a lot of time there.
Both my girls went to college there. So yeah. So I couldn't afford it. I stayed home, I was a mile away. I could walk to class. And so, and tuition was $400.
Oh my gosh.
Back then. So I go and I think I picked business or something. I didn't know what I was doing. And then my first semester, I failed 2 classes pretty much because I didn't drop them properly. But, and I quickly had this come to Jesus moment. Like, you're going to end up in a mobile home that you don't want to live in with a guy who beats you. Like, I was like worst case scenario of what one of my aunts went through.
Yeah.
And if you don't get your shit together, because this is your ticket, and I had never done well in school. So I took a bunch of ologies and I made myself, and I made this promise to myself that I was going to get an A in every one.
Wow.
So geology, biology,
yeah,
I forget. I took like 3 or 4 science classes that semester, and I just buckled down, and lo and behold, I was smart. Yeah. Turns out I was good at academics. I had no idea. Yeah. So I was like, whoa. And all of a sudden I'm getting this new validation. Like people are like, oh, look at you. You made 100 on this. And I'm like, oh, I love this feeling, like I want to keep going in this direction. So I took another geology class because I did really well. The professors were like patting me on the head and telling me how smart I was. And I just kind of kept taking the classes, and they're like, why don't you change your major? I'm like, me? Yeah. And they're like, we have money. And I was like, oh. Right. So suddenly I had a full scholarship, a full ride, so I didn't have to worry about tuition anymore. And I'm doing something I really love.
Yeah.
As an undergrad, and they're taking me to the mountains, and I'm learning about rocks and crystals and all this cool, fun stuff. And I was really, really good at it. Turns out I'm just really good at science and seeing things in 3 dimension and picking out patterns. And so I get my undergrad, I start working for an oil company, and then realize this is not my path.
Right.
Did a stint in grad school in New Zealand for a semester, and kind of there, I kind of got away from all the, my parents and everything. You have to do this. I actually had a PhD lined up in geology.
Okay.
And
oh my gosh.
all funded, paid for, and then decided if I'm going to back out, I have to do something amazing. And medical school was on that list, and so took the MCAT, and here we are.
I admire the risks, like the chances you've taken on yourself. That's sort of something I hear throughout all of our chat is you've taken a chance. It turns out
I'm not afraid to pivot.
Yeah, but I mean that's but I think especially for women, I think that's not always easy.
And I think the most unhappy time in my life was when I couldn't pivot. Those years where I was a mom and the kids were little and Chris was building his career, and I kept feeling this friction of I'm stuck. And that to me is the worst feeling in the world, of being stuck and not being able to create change. And then once I got to a position in life where things were getting paid off, the kids were older, they didn't need me as much, and then I could throw the wrench in and pivot. So yeah.
Yeah, it's interesting. Talk to me about your new podcast, Unpaused.
Unpaused.
Right.
So, seems like lots of people are having podcasts now, so it feels a little bit cliche. But I felt, I've been on so many now, and, I'm so excited to be here. I'm like, and I thought, I think there's a message that I can help deliver, and I can bring out voices I want women to hear. And a lot in the medical space, but I want bigger than that. I want to show that the woman sitting on, my thought is always for when I'm talking on social media, the woman on the couch in Ohio, she's my focus, who doesn't have the access and the resources. What can I give her to help her make her life better? And so that's what I want to do with this podcast. Let her know there's life after reproduction ends, you know, and this life can be absolutely amazing and wonderful. And who can I bring on the show to give her tools, whether it be, you know, an author, a researcher, a scientist, or, you know, anybody really that is really taking the bull by the horns and making this the best third of their lives. So that's why I'm doing it. And so amazing. Unpaused means we're not going to use menopause or post-menopause this last 30, 40 years of our lives. And we're not going to be quiet. We're not going to be small. We're going to be big. We're going to be loud. We're going to take back control and live the best lives that we deserve to.
Oh my God. Amen. Well, you've got your new book coming out as well next year, right?
Yeah. April, the new Perimenopause.
Yeah. I wish that had been around when I was younger. But you're helping women reclaim so much. And so thank you. The question I ask everybody at the end is if, you know, like, what are you working on reclaiming personally?
Me.
Yeah.
Me. Now that I'm done with, you know, I'll always be a mother, but they're grown, you know. I'm solidified in my partnership, you know, like, of course we have our moments, but, you know, we've been together over 30 years.
Congratulations.
And, you know, and he's totally supportive. Like, he is basically retired and is now backing me up in this business. And I want to live my best life. And I don't want at the end of the road to have the same path that, you know, way more options than my grandmother and my mother did. My grandmother spent the last 10 years of her life in a bed.
Yeah, mine too.
Incontinent. Alzheimer's. We didn't know what it was Alzheimer's back then. Absolutely dementia.
Not my maternal grandma.
Completely debilitated and loss of independence. And miserable, you know, and kept telling me I wasn't always like this. Do you remember when I used to play with you? Do you remember? And before she didn't talk in the last 2 or 3 years, but, you know, and Mama's pretty much going down the same path. Now, it took her mid-80s but I'm like, I want better, and I want better for my girls. I want better for our nieces and all the women coming up behind us, all these perimenopausal women, like, they deserve better. Men live shorter lives, so we live longer than men. We rent on when I see the wellness bros and the longevity bros spouting their new gadget and all this stuff. I'm like, that's not going to make my patients, they're not coming in wanting to live to 120.
Yeah.
They don't want to live without their loved ones. I have no desire to live that long. What I want to do is not lose my independence. I want to be independent until the day I die. So take care of myself, drive, cook, clean, whatever, you know, but that my daughters are not interrupting their lives to come and take care of Mama. So I'm trying to stack as many cards in my favor so that whatever time that period is as short as possible.
Wow. That's great. Thank you.
You're welcome.